Welcome back. Maryland Democratic Governor Martin O'Malley and Texas Republican Governor Rick Perry are in the crossfire tonight. What I most want to ask Governor Perry is about health care. And as I said in the break, I'm sure you've been asked this a million times, so the answer should be great. You've been very critical of the president's health care law, the national law on health care. Yet 1 in 4 of your citizens are lacking insurance. They can't get the care that they need. You are refusing to implement the law or take any of its funding. How do you rationalize that with your own citizens?
Well, I think you're wrong in your synopsis there that you say you can't get the care that they need. They do get the care. They got access to health care in the state of Texas. We've made the decision in the state of Texas that this is how we're going to operate our state, that we don't count as a big success the number of people that you put on government assistance. We allow them the freedom to.
So where are they
not
getting
have
their
that.
care?
They get health care in a multitude of different places. Federally qualified health clinics.
Do they pay for it?
Some do, some don't. But the fact is they do have access to health care, so I think it's a bit of a misnomer for you to say that they don't get the health care they need. They do get that. But let's get back to Obamacare and why. We don't want to participate in Obamacare. Number one, we know that it's a broken system. Even the expansion of Medicaid was one of those things that we said we're not going to participate in. And the reason is because even the president himself in 2009 said Medicaid is a broken system. And I agree with you. Medicaid is a broken system. And why would we want to put thousands, tens of thousands of people on a system that is broken? Because it would be tantamount to putting another 1,000 people on the Titanic, knowing how that's going to turn out.
Well, if you did, you'd cut your uninsured rate in half, including hundreds of thousands of veterans in your state who are lacking insurance.
If we were to put $18 billion over the next 10 years is what it's going to cost the state of Texas. $100 billion in total cost is what Medicaid would cost the state of Texas in the next 10 years. We would only see 3% drop in the uninsured rate in the state of Texas. So the idea that you're going to put that
I don't think that that's accurate. And
I do think that's
the other thing is you are talking about for the 1 in 4 Texans that are lacking insurance. Maybe some of them could afford to buy insurance and they're choosing not to, but many of them cannot afford it. So they don't have insurance.
They have access to health care.
So, which means they show up at the emergency room to get their health care.
The left wants to say everybody has to go get
Regardless
insurance.
of that, though.
What we say is people
they are showing up at the emergency room to get their health care.
You know what? The people of the state of Texas have made the decision that that is how they would rather run their health care system rather than allow for Washington, D.C.
The cost of that falls to local communities, hospitals, people with insurance who are carrying those without the insurance. But if you implemented Obamacare, all of that cost would go down.
Well, I suggest to you that the cost, why are the unions standing up and saying that they're against Obamacare now? I mean, the unions, which were one of the strong supporters of Obamacare through the years, because we heard you're going to see your premiums go down by $2,500. Now we know they're going up by $3,000. You said you're going to be able to keep your doctors. We know that's not right. So the whole premise of which Obamacare was sold to the American people, even the labor unions are saying, you know, we don't think we want to participate in this. Thank you very much.
Let me ask Governor O'Malley about that, because you've been a strong supporter of the president. You are a strong supporter. And you run a government, so you understand the importance of actually running something. Obamacare so far has missed 41 out of 82 deadlines. And we're coming right up on October 1st. Doesn't it trouble you that there are that many different parts of the system that are literally not meeting the standard? For example, where they have no check on who's going to apply to get money from the government, and they're going to rely on, quote, an honor system. Now, as somebody who runs a government and balances a budget, doesn't it worry you to think that we're going to give away billions under an honor system?
Well, I think we were talking, when I was listening to the governor earlier, he was talking about a broken system. What we have right now is a broken system. For our part in Maryland, I can't speak to the 41 misses in a federal bureaucracy, but I can tell you that we've decided to be an early implementer of the Affordable Care Act. And we know that there's going to be hiccups. We know that this won't be easy. But we also know that it's crazy to depart with 17% of our GDP for health care. No other industrial nation does that. When I was a boy, it was about 5% of GDP for health care. So we believe that we're going to have a competitive advantage on states like Texas that don't implement this.
So let me build on that for a second. I'm going to ask you two other questions. One is, you just saw Walgreens announce that they're dropping their corporate insurance and they're going to give people money to go out and buy their own insurance. Doesn't it concern you when you see big companies like that, in essence, saying to people, we're now going to dump you onto the exchanges, good luck? And doesn't that change what has been the #1 insurance model for the whole country, which was an employer-based system?
Well, sure, it's concerning, and we need to be able to be willing to adjust and make changes as we move forward with this. If this were easy, we would have done it long ago as a country. For our part, though, we will be meeting the deadline come October 1st. We have a lot of smart people working to implement the exchanges, and we're moving forward, not back. And we're excited by the challenge. And we know also, we think that we're actually going to be able to increase our competitive advantage, and that even more people will start businesses when they don't have to worry about losing their health insurance if they move from another plan. So we're excited about what this can do for our competitiveness.
So do you think in that model, looking at Walgreens and others, and in your own state, 2 community colleges have now announced they're going to have shorter time periods. I think Ocean City government has announced they're going to have shorter time periods. They have fewer people who are eligible because they keep them under 30 hours a week. I think a major corporation has also done that. Do you think it would also be fair then for state and federal employees to have to go to the same exchanges under the same conditions as employees at places like Walgreens?
Well, I suppose if their government dumped their health insurance, they'd have to. But I think
they simply gave them the money like Walgreens.
Well, Walgreens, just to correct the record here, Walgreens is going into a private exchange. It's pooling its coverage with other private businesses, an option that they didn't have before. If they have the ability to lower costs and provide better care, why shouldn't they be allowed to do that?
But they're not going to provide group insurance. They're going to give people a voucher.
Hey, Martin, let me ask you.
But their costs are going to go down.
From the standpoint of a couple of governors who have the responsibility to make decisions in each of our states, wouldn't you rather have the flexibility that Washington, D.C. basically said, listen, we think Maryland knows best how to run the health care program in the state of Maryland. That's one of the things that I've been promoting for a long time, is the idea of the flexibility of block granting back to the states. And we could never get the federal government to allow us to do that. That's one of the things that I wish.
Well, the law actually allows you to do that.
Well, not as far as block granting goes, because we've asked multiple times to have the ability to allow Texas to set its own program into place, and we think we're very capable of, and I think you're capable of making those decisions better for Maryland citizens than somebody in Washington, D.C. with a one-size-fits-all. And that's my problem with Obamacare. It's Washington, D.C. forcing the states to meet all of these standards, and that's why we've said, no, thank you, we're not going to participate with this, we're not going to be involved in the exchange.
We haven't had that experience. Yeah. We've actually found that HHS has been very responsive. We've found that we do receive the flexibility. You and I differ in terms of, capping it and block granting it and not letting people sign up. But a lot of the other governors are also having are receiving the flexibility. But if you don't want to do it, you're not going to do it.
That's going to be our choice. We're not going to sit there and allow for Washington, D.C. to make decisions for how health care is delivered in the state of Texas and bankrupt our state, because we've run the numbers, and we think that there is a clear path towards the bankruptcy not only of our states but of this country if this goes into place the way that it's set up today.
You should come to the National Governors Association meetings again. I know Texas seceded from the National Governors Association, but if you came, you might be able to learn from some of the other governors that are actually implementing this, doing it well, and actually doing a better job of supporting an innovation economy and their workers' well-being.
Well, the bottom line is going to be by seeing which of these states succeed as we go into the future. Right now, on job creation, Texas is leading the march.
And on schools and median income, Maryland